Hey, this is Dr. Amanda from StraightSmile Solutions, and we had a great question come in today about getting teeth pulled. The question is, should I have teeth pulled to fix my bite? And personally, my personal philosophy is always no. I'm totally against that for the most part. 99.9% of the time, I'm gonna say no to that, and I'm gonna find a workaround. I'm gonna find a way to work around it to avoid that. Because I'm just not a fan of that. I'm not a fan of it philosophically. I'm not a fan of it from an airway space and the space for the tongue. Of course, discomfort for you and cost for you is not a choice either. But every doctor has a different philosophy. So make sure you ask that philosophy up front and try to think, is there any other options? And what do these mean? So some of these other options that may be non-extraction options may involve a lot of compliance from you. And compliance means that you need to wear something 24 hours a day. That might affect the way you talk or look, might be glued in there, it might be removable to help fix your bite. So obviously the younger you are, and if you're still a growing child, the better the outcome is with these kind of things. So if you're completely done growing, you're an adult, or you're skeletally done growing, that means your bones are done growing, you're not, your feet aren't getting bigger or anything like that. There's going to be more limitations with trying to correct a bite because you don't have that play. You don't have that give from bones still being soft, still being pliable, being able to direct growth in one direction or another, inhibit it or advance it. So hopefully it doesn't sound too complicated for you, but there's so many ways to correct a bite. Yes, extraction is one and a fairly common one, but it's always great to find a doctor who thinks outside the box, finds other ways to do things. So feel free to have your doctor, if they totally fixed on extraction, just say, hey doc, you maybe should visit StraightSmile Solutions. There's a bunch of ideas in there, you know, all different kinds of appliances you can use, all different kinds of systems you can use, and connect with the team there and they can help you out.
And we're going to be talking about this case today. This is could be your typical overjet case, class 2, most likely division 1, division 2 case, where there's a blocked out lateral. This is just kind of what it looks like maybe in the early stages of braces. If you were to do braces to correct this, here's kind of some of my concerns about treating this case only with braces is that you've got overjet here. You know, the overjet is not going to go away with the braces only because most likely there's a deficient mandible as well. Could be an airway problem as well. So you do need to really address the real cause of the problem, find out where the deficiency is skeletally, and if this child is still growing, which I'm guessing that she is, you need to address that as well. So many different ways to do this, and I think sometimes we're just throwing braces on, getting the teeth straight, correcting the bite with rubber bands, or pulling out teeth on the top, and we're really setting up the child for future problems later, and we're just starting to see this stuff now. So if you are a fan of non-extraction, if you're a fan of the philosophy of airwaydonics, really treating your patients with a fundamental philosophy of airway in mind with your braces, you need to connect with me on YouTube, subscribe to my site, to my domain, and go to StraightSmileSolutions.com, connect with me, we can have a consultation. All right, thank you so much, bye-bye.